This conference will now be recorded.
All right. So let me introduce myself to people who've just joined. Hi, my name is Dr. Bhavna Sharma. I work as a medical registrar in NHS London, and I'm currently doing my specialization or my super specialization in endocrinology from Imperial College London. So we're going to start now. Guys, today is a continuation of our previous session on OET writing, where I tried to give you a cheat sheet on the middle paragraphs in OET writing. This is today's session is going to include paraphrasing a hospital admission. So a lot of times on your OET writing, the task actually talks about the patient getting admitted to the hospital. It's usually the hospital that the person writing the letter is in. So you might be a nurse or a doctor who's had this patient admitted under your hospital or under your care, and then the patient is getting discharged onto their regular care. So it's going to be a discharge letter, or it might be a transfer letter where this patient was admitted in your hospital for something and now they're getting transferred across to another hospital. And the purpose of the task is that you summarize the hospital admission and express that in good language. So just to cover that, just to cover the middle paragraphs for that, I'm going to do today's session on history of hospital admission. If you want to know about the cheat sheet for introduction and conclusion, depending upon the type of letter that you have, you can visit our YouTube channel, and I have provided cheat sheet for good conclusions and good introductions on the OET writing, depending upon the type of letter that you have. The second part of today's session is going to be on examination. So I'm going to be covering how we would express various systemic examinations and paraphrase various systemic examinations as they appear on your OET. This does appear when you have a patient that you have been seeing for a long period of time, and now you're referring this patient on to a specialist. So it's a referral letter to a specialist, and in that referral letter, you're supposed to elaborate the examination into proper sentences, and that's basically the crux of how you get scored. So that's going to be the second part of today's session. Like always, guys, please remember the concept of audience awareness. So whatever you write in the middle paragraphs has to be pertinent to the person that you're writing the letter to. So you need to be aware of what information that person is going to need in order to keep caring for your patient. So audience awareness, very, very important concept. If you still don't understand what audience awareness is, please go through that again, because it's one of the failing points of people not being able to realize what information is actually to be included when we're writing an OET letter. Okay, let's just move on to the first part of today's session, which is talking about how you would elaborate the history of admission for a patient. Okay, so when you're talking about a hospital admission, you're going to first tell them about when this patient was admitted, what happened during the course of this admission, what were they diagnosed with, what treatments were given to this patient, and then you're going to talk about the discharge. So your middle paragraphs, if you've got a lot of history, what I would suggest is make 3 paragraphs for the 3 middle paragraphs. So you're going to introduce your patient in the introductory paragraph. Then you're going to write about this patient's admission. When were they admitted? What were they admitted with? Then the middle part of this is going to be what treatments were provided to the patient or what they were diagnosed with. And then the third part will include the discharge details of the patient. What was the discharge plan for this patient? So we'll start with how you would start your middle paragraphs by talking about when this patient was admitted to the hospital. So 3 ways that you can talk about the patient getting admitted to your hospital. Mr. Smith was admitted to hospital. Guys, what the official OET tells us is that we are supposed to avoid the as far as possible. So when you're writing, that the patient was admitted to the hospital, I would prefer that you write to hospital rather than to the hospital, because it's just something that the official OET has given us. So Mr. Smith was admitted to hospital on 24th December. Notice the way that I've written that. So we're going to just expand that rather than writing 24/12/2007, 24th December 2007, due to severe abdominal pain. It's not going to be due to his severe abdominal pain. It's just going to be due to severe abdominal pain, because when you're talking about the patient getting admitted with something, you're going to write due to that symptom. Okay. Um, Sometimes the patient might have a life-changing event or a significant event after which they're admitted to a hospital. How do you write that? You write, Miss Jones was admitted to St. Mark's Hospital on 20th June 2020 after a road traffic accident. Similarly, if the patient was admitted with a stroke, you're going to write after a stroke or after a heart attack. So if there's a significant life event or a significant event after which the patient was admitted, you're going to write after that incident. Okay. You can't write after abdominal pain, because that's not a significant event. That's actually a symptom they were admitted with. So if they're admitted with a symptom, it's going to be due to that symptom. And if they're admitted after a significant event, that's going to be after a road traffic accident. Sometimes the patient might have multiple episodes of something and then they get admitted to a hospital. How do you write that? You write that as Mr. King was brought into. So sometimes what might happen is that the patient doesn't admit themselves, so they don't actually walk into the hospital to get admitted. They're actually brought in by an ambulance. So how do you write that? The Mr. King was brought into Uxbridge Hospital after a series of uncontrolled seizures. Guys, one very common mistake that people do is that they write bought into hospital. Bought means that you buy something. So the past tense of buy is bought. But when the patient is coming into a hospital or is brought into a hospital, that's the spelling is different. So make sure you don't make that spelling mistake. That's actually a very common mistake that students make. Okay. A very good way of expressing multiple symptoms that a patient has is after a series of uncontrolled seizures or after a series of um, uncontrolled strokes. Perhaps you can write. So 3 ways that you can express a patient's hospital admission, where you have to talk about the date and you have to talk about the reason why they were admitted to the hospital. So take a screenshot of this. This is going to be the first part when you're talking about a patient getting admitted to a hospital. Once you've taken a screenshot, we'll move on to what we would write after this. So guys, if you're done with this slide, just type in yes, and then we'll move on to the next one. Okay. All right. Moving on. Okay. So Dr. Sonia has asked to repeat the third one. So Dr. Sonia, when you're talking about a patient being admitted to a hospital by someone else, for example, they are unconscious or they are very, very unwell, so they're not really conscious enough to admit themselves into a hospital. A good way of writing that is Mr. King was brought into the hospital because someone else brought them to the hospital. They didn't come into the hospital, they were brought to the hospital. And then if you're talking about multiple symptoms the patient might have had, you write after a series of uncontrolled whatever symptoms they had. Okay. So that was the third one. Now moving on to the next part is when you're going to talk about the diagnosis that you found on this admission? So the patient has come to the hospital with something, they came in with the symptoms, and then the hospital decided that they had a certain diagnosis. How are you going to write that? A very good way of writing that is using some good OET connectors. You've written that they came in with severe abdominal pain. So a good way of connecting that to the next sentence. Subsequently, comma, Mrs. Roy was diagnosed with acute appendicitis. She was also found to have sudden, found to have new onset atrial fibrillation. Another way of connecting the first line to the second one is consequently, comma, Mrs. Gomez was found to have multiple fractures. Full stop. However, there was no evidence of any intracranial injury. So some connectors which you can use when you're describing a hospital admission. So very good way of fulfilling two OET criteria of including connectors. After on the 29th of October 2019, is that the space that you're mentioning? Just let me know and then we will solve your query. Okay. Dr. Sridhar, I don't really understand your question as to where you're talking about this space. If you're talking about during the course of this admission, you can leave a little bit of space, but because the OET, they won't really give you, they won't really give you a hard time if you miss out on this space here because it's very, very minor. All right. Okay. Good. And now this was the history of hospital admission and how you would be paraphrasing a hospital admission. Guys, if you've understood paraphrasing of a hospital admission, it's actually quite important because this is one of the very common letters which appear on your OET. If you've understood the cheat sheet as to how you would write a hospital admission, please type in yes, and then I want to move on to examination because that's actually quite important as well. Okay. Excellent. So examination, guys, examination can appear in a number of ways. You might have a patient who's had multiple visits to you, and they've been coming to you a number of times, and you've examined them a number of times. And on each examination, you found something new. Or it might be that the patient was admitted to the hospital with something, and on examination in the hospital they were found to have certain examination findings. Those are going to be written in your case notes in short forms, and on your OET you will be asked to expand them into proper sentences. Okay. um, so it can appear in each type of letter that you have. So it doesn't really discriminate in between the type of letter that you have. It can be on referral, transfer, as well as discharge letters. But what you need to remember, the main thing that you need to remember is that all of the examination is going to be in the past because you examine the patient at particular points in history, and now the examination has ended. So it's going to be in simple past tense. Okay. And how are you going to write various systemic exams is what we're going to discuss. What I've done today is I've divided the examination into systems. So I'm going to be talking about respiratory examination, and then so on and so forth. And then we're going to be talking about how you can write your respiratory exam or your vitals exam in very, very nice English so that you score good marks on your OET. Okay, lots of students make mistakes in vitals. So it's quite important that we discuss this today. Guys, you don't always need to mention vitals, especially if they're normal, because remember, on your OET, you are assessed on including the significant history. So if the vitals are significantly abnormal, that's when you're going to be including them. Um, so how would you write vitals? You would write at the time of examination, comma. Dr. Sridhar, you might leave a space there if you want. Mr. Jones was tachycardic at 120 beats per minute. Okay. So if you're talking about somebody's vitals being something, the connector that you're going to be using is going to be at. Okay. So Mr. Jones was bradycardic at 40 beats per minute or was tachycardic at 120 beats per minute. And if you want to talk about blood pressure, simple way of writing that is his blood pressure was 80/60 millimeters of mercury. You don't really need to expand that because this is a universally accepted value. It's like centimeters square or centimeters or meters. So you shouldn't be really writing millimeters of mercury because this is a standard unit. Okay. Mr. Jones, vitals today. Guys, if you have somebody's name which ends in an S and you have to put in a possessive connector, you can just write Mr. Jones and then a colon after that. So Mr. Jones' vitals today revealed a low pulse rate of, okay? So if you're writing about tachycardic or bradycardic, it's going to be at, and if you're writing about pulse rate, it's going to be a pulse rate of 50 beats per minute, okay? Because the tachycardic is a value at which somebody is set, and the pulse rate is something that a person has, okay? So pulse rate of and tachycardic at, very, very important when we're talking about vitals. A way of writing normal vitals, you can write on this visit, Mr. Fate has been found to have normal vitals. Vignesh, I didn't really understand your question. Can we use with for at? So if you're writing tachycardic at, you shouldn't really write tachycardic with because that's not grammatically correct. You should write tachycardic at. Okay, so that's how we're going to write vitals. Guys, if you've understood vitals, please type in yes, and then we'll move on to respiratory examination and how you would paraphrase it. Okay. All right. So respiratory examination, very, very important and very, very difficult to paraphrase. Now remember, guys, all of this is going to be in short forms on your OET case notes, okay? And the purpose of your OET is then to expand all of this into proper sentences, okay? So how would you write each examination finding is extremely important because that's one of the things how they're going to assess your grammar or your language on OET. So way of writing about examination is you can write on examination, comma, and then your patient's name, was found to have an increased respiratory rate. Okay, remember you have to write in the past tense was found to have, and then guys, if the respiratory rate is increased because this is an I, you're going to write an increased respiratory rate. If it's a decreased respiratory rate, you're not going to write and decrease because D is not a vowel. So you're going to write a decreased respiratory rate. You're going to write an increased respiratory rate. He had an increased work of breathing. So again, because it's an I, A-E-I-O-U are going to be preceded by an. So that's why it's an increased work of breathing. Okay. Now the patient might have certain findings on inspection. Guys, everybody knows this, but unfortunately on the OET we get very confused. Remember, you're going to be inspecting the patient, palpating the patient, percussing the patient, and auscultating the patient. Okay. And that's what they're going to write on the case notes. So just expand that into how you would in your normal day-to-day life. On inspection, comma, Mr. Wilson was noted to have scoliosis with a deviated trachea. Okay. So when you inspect someone, the verb which comes with that, two good verbs which come with that are going to be was noted to, because that's something that when you inspect it, you noted something. So Mr. Wilson was noted to have scoliosis, or you can write Mr. Peters appeared to have a congenital chest deformity. Okay, guys, when you're talking about a deformity that the patient has, because they can have multiple deformities, you're going to write a congenital chest deformity, because deformities can be multiple. But you can only have one scoliosis. Okay, you only have one back and you only have one scoliosis. That's why I did not write Mr. Wilson was noted to have a scoliosis. Okay, because scoliosis, you can only have one scoliosis. You can only have scoliosis. You cannot have multiple scoliosis. Okay, while you can have multiple deformities, so that's why you have to write a congenital chest deformity. Okay, so three things important when you're talking about a patient's inspection findings. On inspection, comma, was noted to have, was noted, and appeared to have. Okay, because the noting was done by someone else, that's why it's was noted. Okay, appeared happens to everyone, so it's appeared, not was appeared, it's going to be appeared. Okay, and then have scoliosis and have a congenital chest deformities. These points are very, very subtle, but these are the points which make you fail the OET. So very, very important, guys, that we pay attention to this. If you've understood these two sentences and the three main points I told you about, please type in yes. I'm very, very happy to explain this again. If you are still confused, just let me know and then we'll move on. Okay, so the way that you write about inspection findings. So inspection finding basically means you all are doctors and you all are nurses. So I might be preaching to the choir, but inspection basically means what you see on the patient. Okay, so the way that you write that is you write on inspection, comma. Okay, that's the common thing. Mr. Wilson, the two verbs that you're going to use, was noted to have, just memorize this, was noted to have, and otherwise an alternative of this is appeared to have. Okay, because the noting was done by someone else, that's why is was noted. Okay, but the appearing was done by the patient himself, so he appeared to be something because the patient appeared, no one else made him appear. That's why it's not was appeared, it's appeared. Okay, scoliosis, you can have only one scoliosis because that's one finding per patient, so that's why you've written. So scoliosis is basically a abnormality of the back which you can only have once, so that's why you've written was noted to have scoliosis. But the chest deformity, you can have multiple deformities in one patient. So that's why it's a congenital chest deformity, because it's lots of deformities per patient. That's why it's a congenital chest deformity. And because the scoliosis is one per patient, that's why there's no a here. So Malik, Sanjida, if you've understood, please type in yes. Excellent. Okay. Now we're talking about palpation findings. How would you write that? Um, you can write when palpated, because the palpation happens at a particular point in time. So you can write when palpated, Mr. Mooney had localized tenderness over his left lower sternum. Okay. Or you can write the same thing. On palpation, comma, Mr. Mooney had generalized tenderness all over his chest. Okay. So the tenderness is always over something. Okay. Not at, not in. The tenderness, the connector that you're going to use is going to be over his left lower sternum or all over his chest. Okay. Now, when you're percussing someone, you demonstrate percussion, okay, because that's something that you do to an audience, or when you're doing it, you do a certain procedure and you find something. So the way, a best way or a good way of writing that, the best way, not a best way, you would write that as Mr. Fulton was demonstrated to have dullness to percussion. Okay, so how would you write percussion? Dullness to percussion over his left lower lung. Guys, very, very important. Was demonstrated to have dullness to percussion. Okay, no one's going to make that mistake again. Dr. Zafran, if you're writing about resonant, you would write Mr. Fulton was demonstrated to have resonance to percussion over his left lower lung. Or if you want to write another option is that you can write Mr. Fulton was demonstrated to be resonant to percussion over his left lower lung. So have resonance, be resonant. Okay. Dr. Zafran, if you've understood that, please type in yes. And then we'll move on to auscultation. Okay. When you're writing about auscultation, guys, please remember this is going to be very, very in very, very short forms on your case notes. So everything you're expanding now. You're going to write, Mr. Stephen was noted to have a widespread wheeze, because you can have multiple wheezes. That's why it's a widespread wheeze. Okay. On chest auscultation, not in chest auscultation, not at chest auscultation. It's going to be on chest auscultation. Another way of writing that, on auscultation, comma, Mr. Wilson was noted to have reduced air entry or a reduced air entry over his right lower lung zone. Not zones, because we're talking about a particular zone. It's going to be singular, and auscultation is always over, because your stethoscope is placed on the patient's chest, because it's over a patient's chest. So the auscultation findings are always over. Okay, guys, very, very, very important. Tenderness and auscultation as well as percussion is always over a particular area. Okay. If you want to write about bilateral findings, how would you write that? On auscultation, comma, Mr. Wilson was noted to have bilaterally reduced air entry over both lower lung zones. Okay, because there are multiple zones in which you found findings. Dr. Zafran, you're going to write as Mr. Jones was noted to have reduced air entry bilaterally over both lower lung zones. You can either write that or you can write Mr. Jones was noted to have bilaterally reduced air entry over right as well as left lung zones, left lower lung zones. You can also write that. Okay. Dr. Safran, if you've understood that, please type in yes, and then we can move on. So you can write on auscultation, Mr. Jones was noted to have reduced air entry bilaterally over both lower lung zones, or you can write on auscultation, Mr. Jones was noted to have bilaterally reduced air entry over right as well as left lower lung zones. Okay, excellent. Guys, if you've understood how you would elaborate respiratory examination, please type in yes. Now that you've attended today's session, I want no one to make any grammatical mistakes when you're writing about respiratory examination, okay? And if you write like this, I guarantee you, you're going to get very, very good marks on your OET writing. So I don't want anyone to make that mistake again. If you want, you can take a screenshot of this and then you can use it on your OET. Okay. All right, we're going to move on to abdominal examination. So examination, the basic principles are quite the same. So on inspection of his abdomen, Mr. Wilson was noted to have multiple surgical scars. Okay, so similar to respiratory when we're talking about abdominal exam. When palpated, Mr. Mooney was demonstrated to have localized tenderness over his left lower abdominal quadrant. On palpation, Mr. Mooney complained of generalized superficial tenderness. So the tenderness can either be deep tenderness or superficial tenderness. So how do you write that? So guys, when someone has tenderness, you either write has tenderness or complained of tenderness. That's a good way of writing that, because you can't demonstrate, you can't actually say that the patient has tenderness unless they tell you, okay? So you can write that as complained of. Even though it's an examination, you can still write on palpation, Mr. Mooney complained of generalized superficial tenderness all over his abdomen. He did complain that the tenderness seemed to be worse on the right compared to the left. So this might happen that the patient might have tenderness all over, but the tenderness is particularly bad in one area compared to the other. So very good cheat sheet of writing that is, he did complain. Guys, we discussed this before as well in our previous session. when something is a little counterintuitive, you can write he did complain. Okay, he did complain that the tenderness seemed to be worse on the right compared to the left. So a good connector compared to, because we are comparing two things, you can write that as compared to left. This was associated with guarding in the left lower abdominal region. So if they have something associated with the tenderness, you can write that as this was associated. Okay, everything is in the past tense because the examination has already happened. Sanjita, you can write he reported, but the way that you're going to write that is on palpation, comma, Mr. Mooney reported generalized superficial tenderness. It's not reported of, it's going to be just reported generalized superficial tenderness. Okay, it's always complained of and reported. There's no of when you have reported. So make sure, Sanjita, if you're using that, you don't add an of after that. Sanjita, if you've understood that, please type in yes. Another way that you can write is Mr. Fulton was demonstrated to have dullness to percussion. Yes, Zara, he did report is emphasizing it. Okay, emphasizing it or saying something which is a bit counterintuitive. Okay, if you're talking about vowel sounds, please write it in the last sentence. Mr. Stephen was noted to have normal vowel sounds on auscultation. So very, very similar when you're talking about abdominal examination. But this is all something that all people mess up on. But because you've seen this lecture today, none of my students are going to make this mistake again about examination. So similar things. Cardiac examination again can be written as during his cardiac examination, Mr. Norton was found to have muffled heart sounds. So if somebody has reduced heart sounds which you can't hear, the English word that you're going to use for it is muffled heart sounds, okay? Because something is making the heart sounds reduce when you're trying to listen to them. So good way of writing that is muffled heart sounds. Or you can also write, on auscultation of his heart sounds, Mr. Norton was noted to have a loud P2. Guys, you can write S1, S2, P2 because they are medical terms and they are accepted all over the world. I wouldn't really expect you to write second pulmonary sound. Okay. If you've got, for example, if you've got someone who's got heart failure symptoms, or in any examination, you've got someone who's demonstrating something which is clearly pointing to something, you can write things like, Mr. Johnson's cardiac examination revealed evidence of, so revealed an evidence of decompensated heart failure in the form of bibasal pulmonary crepitations along with added heart sounds of S3 and S4. Okay, so basically, if you've got someone who's got in your examination findings, the way that OET gives you the examination findings is on examination, signs of decompensated heart failure. The way that you expand that is going to be Mr. Johnson's cardiac examination revealed evidence of decompensated heart failure. So evidence of is very good method when you're talking about somebody's examination in the form of, and then you give examples of why you thought that he had a decompensated heart failure. Zara, this is going to be uploaded on YouTube quite soon. So make sure that you have subscribed to our YouTube channel, Teachio Academy, if you want to see this session from the start. Okay. So that was cardiac examination. Okay, neurological examination is quite difficult to express because it's got a lot of variations. It's a bit more difficult. If you're talking about a patient's gait, a very good way of writing that is, guys, please memorize this sentence. On being asked to walk, Mr. Edwards was noted to have a fascinating gait. Okay, so everybody's gait is written in that way. So it's going to be shuffling gait, fascinating gait, stamping gait. There's always an ing when you're talking about somebody's gait. Very, very important point to note. He also appeared to have difficulty in turning around and was unsteady when asked to do so. So during a neurological exam, you might ask the patient to do something. A good way of writing that is, he also appeared to have difficulty turning around and was unsteady. And then the phrase that you use after that is when asked to do so. Ola, basically, you can use uppercase words if you want. Okay. Then another way that you can write this is that Mr. Smith was found to have difficulty in finding words. When you've got a patient who has difficulty in doing something, the way that you write that is, Mr. Smith was found to have difficulty in finding words. Or you can write that as, it also appeared that he was slurring his words repeatedly. Okay. If you want to write that in another way and you want to make the patient the main thing, you can write, he also appeared to have difficulty in finding words. Okay. He also appeared to have is another variation. But if you got copy paste this, you should be correct as well. Guys, reflexes, you always demonstrate reflexes. It's similar to percussion. How would you write that is, Mr. Smith was demonstrated to have reduced reflexes on testing his whatever portion the reflexes were tested on. Guys, please memorize this sentence. It's actually very, very important because a lot of neurological findings are about reflexes. So the correct way of writing that, or a good way of writing that is, Mr. Smith was demonstrated to have reduced reflexes on testing his right leg. Another thing which does appear when you're examining somebody's neurological system is that they may have reduced sensation somewhere. How would you write that? Mr. Smith also had reduced sensation to touch. Okay, you always have reduced sensation to something. Okay, so you have to write that as, Mr. Smith also had reduced sensation to touch, comma, pressure, along with temperature sensation loss over S3 as well as S4 dermatomal region. So you always have a sensation to something, or you have a sensation loss over some region. Okay, that its sensation loss is never in a region, it's always over a region, because you always sense something on top of your skin. So that's why, like auscultation, it's going to be over that region. Okay, guys, if you understood neurological examination, please type in yes, because this is often the most difficult one that people struggle with. What I've taught you is how you would write, how would you write about gait, how you would write about anything that you ask the patient to do, how would you write about difficulty in finding things or doing things, how would you write about reflexes, and how you would write about sensation. If you've understood that, please type in yes, and then we can move on. Very, very important. This is always written in very, very small letters. They'll just write reduce like a arrow, sensation, touch, pressure, pain, S3, S4. But you have to expand that, and this is the way you would expand it. Excellent. Binsi, that's right. It's around that region. That's why you write around. No, but Binsi, if you're talking about sensation loss, you can write around, but a better way is over, because sensation is always over. So around is also okay, but over is better, Binsi. Okay. Malik, you can write was found to have reduced sensation as well. That should be fine. You can write Mr. Smith was found to have reduced sensation to touch, comma, pressure. Malik, if you've understood that we can write was found, please type in yes. Excellent. Guys, make a screenshot of this. This is very, very important. Neurological examination is the most messed up paraphrasing on the OET writing. So make sure you don't do that again. All right. I just wanted to talk about a few special examinations which do appear. Sometimes you get PR examination quite a lot. So how would you write that? You're going to expand the PR into per and then colon rectal. His per rectal examination revealed loss of anal tone. If you're talking about per vaginal examination, you're going to write her per and then not PV. You're going to write per vaginal examination revealed a curdy discharge. Guys, you always have a discharge because you can have multiple discharges. Okay. So a discharge. Okay. And then if you've got somebody that we've done a fundoscopy on, you can write her fundoscopic examination revealed changes suggestive of diabetic retinopathy. For example, if you are given a case note where it says fundoscopy, diabetic retinopathy or severe diabetic retinopathy, you're going to expand that to be her fundoscopic examination revealed changes suggestive of diabetic or severe diabetic retinopathy. Okay, so these are also three things that I just wanted to briefly mention. Okay. All right, that was the end of today's session. We've covered examination and history of hospital admission on this session. Guys, if you have any further doubts, please let me know. Again, if you want to join our writing as well as speaking check, please WhatsApp us on the number provided. Or what you can do is you can visit our website, which is www.teachioacademy.com, or you can text Dr. Prashant on the number provided, and he can guide you through the process as to how we do our writing and speaking checks. We are the only academy which teaches you the OET by doctors as well as nurses and very, very good English teachers. So we do provide you with an overall view of OET, which no other academy has. Sumit, I'm going to be discussing about investigations, including lab values in our next session. So please make sure that you are on our Telegram group or on our WhatsApp group to receive the meeting link when it's done. It's quite important that we're going to be talking about it in a separate session because that's also a very long lecture. Dr. Zafran, I'll try and do the next session either on Wednesday, or we might have to postpone it because I'm on call the next weekend, so I won't be able to do this session next Saturday or Sunday. Malik, if you want to just have the sample letters which have already been checked by Teachio Academy, please text Dr. Prashant on the number provided and he can provide you with our sample solved letters. Guys, our letters are checked by a doctor as well as nurse, a doctor or a nurse depending upon your profession, along with a English teacher. So your feedback is divided into a doctor's feedback and an English teacher's feedback. And along with that, you are going to get a detailed study plan as well as a detailed marking. And it's similar for your speaking. So if you want to enroll, please text Dr. Prashant on the number provided. Sanjida, percussion, look at the spelling of percussion. It's Percussion. So make sure you don't make that mistake. And you can write was demonstrated to have dullness to percussion or resonance to percussion over whatever region you did the percussion at. Sanjida, if you're still confused, this is going to be uploaded on YouTube, as well as when I take the next session, make sure that you join once you've revised everything and you've tried to solve the problems in your mind and try to use this on your OET practice letters. If you still have doubts, I'm happy to answer them in our next session. Okay, but make sure you join that. Okay, so guys, if you are interested in the group discount, we are going to be submitting a group very, very shortly. So please text Dr. Prashant if you want to save about 60 pounds or 60 to 80 pounds on your next OET exam. Okay, so that was the end of today's session. Thank you guys for joining us. I hope you had fun. I hope you learned something new, and hopefully the middle paragraphs are not going to be a problem for you anymore. Keep safe, keep studying, and I hope you guys do very, very well. Good luck.